That said, it's time for us to talk about talking. And here to talk about an issue that affects more than 70 million people in the world, affecting celebrities that you and I know, like L Jackson, musician Ed Sheeran, and even the United States of America current president, Joe Biden. It's stuttering. And here to talk about that is Dr. Sintieh. You're welcome.
Thank you very much, Patience, for having me.
How are you doing?
I'm perfect.
First off, before we move into all of this, congratulations, because you were declared Mr. United Nations Cameroon 2022.
Exactly.
How does that feel?
Well, it feels awesome, you know. A doctor in a beauty contest.
Exactly.
And coming out champion.
Yes.
You know, it means a lot. So it's an opportunity for me to use beauty for health benefits.
That's true.
Exactly.
And I'm sure the fact that you know a lot about these messages counted in your victory.
Exactly.
And talking about stuttering today, it's something that people laugh at because they do not understand it. Maybe we start by defining it.
All right. All right, so good morning, patients. And so that is what stuttering is. So stuttering is just repetitive altering of some consonants, G, T, K.
Okay.
All right, and also short words repeating the syllables. And also you get their words, and then they have breaks. So it's commonly called stammering in Cameroon and in other areas. Scientifically, we call it a disfluent speech disorder. All right, so basically that's what stuttering is. And it's something that is common among all age groups, okay, but it's more frequent between children aged 2 to 6 years and above. And then males are more frequently affected. And as you grow old to adulthood and between teenage and adulthood, the boys are 4 times more likely to be stutterers than females.
Okay.
So like we're talking about stuttering, I feel like stuttering.
Yes.
So
but what causes it then?
So we discuss the causes of stuttering into 3 classes. First, genetic component. All right, this is coming from inheritance. So if you have a family person, if you are stuttering, there's a likelihood that your children will stutter.
Yes.
All right, so if there's someone in the family lineage that is stuttering, there's a likelihood that you might have someone that will be stuttering. The second is what we call brain, is associated to brain injuries. So we have persons who have had strokes, heart attacks, and the rest. It leaves the damage on the brain, and it influences the speech center, and so they have a stutterer. Now, the least most frequent form of stuttering is what we call the psychogenic. It comes from people who've had a severe emotional or psychological
that can cause stuttering.
Okay. So basically, the people we see very depressed. You remember one time we were talking about depression. So we see severe people. By the time they're recovering, some of them, before they get the confidence of talking back, they actually stutter. So basically, those are the causes of stuttering.
How does stuttering complicate a person's life?
All right, I kind of belabor the point, but the first thing is that communication is very difficult. All right, and with the common society that we find ourselves in, these persons have a lot of stigma. They're under a lot of pressure, low self-esteem. Getting a job is challenging.
Yes.
And we are very proud of celebrities who have actually marketed this stuttering to their advantage, and that's what we always encourage everyone to do.
Yes.
All right, because it really influences how these children perform in school if they don't have understanding teachers and parents as well.
And even peers, just having peer pressure and mockery make them not even want to try to talk.
Exactly. So that is how it is. And even in the company, some people, because of their speech, they can't get the job. They might go for a written test. They pass very well because they are very intelligent. But when you get to the interview, they can't express themselves. So you find interviews where they tell you have 2 minutes to present what you have to do.
Yes.
Someone stammering, someone stuttering will have difficulties.
Isn't that something that should be adapted within our system, where we do not discriminate against people who stutter and give them the opportunity to excel or be employed as well as others without speech impediments?
Exactly. Some companies in their interviews, they'll tell you, indicate if you have a speech impairment.
Okay.
And so there's always a room for people who are handicapped. But I don't know how, if every company in the country is implementing that.
Yeah.
So it's on a balance. But I
Yeah,
think
that's why we're talking about it. So if you're watching right now, you should establish that within your company and even at home or even in school in particular, because that's where it starts. How can someone with a stutter live in a society? What would you advise?
All right. So if you're out there and you're stuttering, you're listening to me, first thing I want you to know is that you're perfectly normal. All right, you are not the only person stuttering. Now, how do you go about your day-to-day activities? The first way to be able to help you express yourself is to enroll in choirs, singing, read a lot, and also talk with other persons. So why do we say this? When you do this, your mind, your brain, your speech center helps to synchronize these words. So everyone that is stuttering, I will encourage you to enroll in a choir, sing as much as possible, read novels. Now, it increases your vocabulary. It helps the blend, the coordination between your speech center and your muscles that are responsible for producing voice. Now, that is what you can do. Now, secondly, do not be pressured. When you're called to talk, take your time. Slowly and talk. Do not be pressured.
Sure.
It is okay for you to repeat the words inside of you before uttering them out. And if you must stutter, it's okay to stutter and don't feel embarrassed. Because what happens is, once you stutter, you lose what you want to say and you think that you're embarrassing yourself. But no, it is okay. So basically, those are ways you can adapt yourself. Now, next is we have very few speech centers in the country. So I tried to search, but I couldn't really get a site where I could recommend. But I have very limited speech centers and speech specialists around, and you want to enroll in these persons. Now, if you have a child, a spouse, a sibling who is stuttering, give them time to listen to them.
Yes.
Pay attention to when they are talking. Now, if that child is yours, you want to get the sense of the child when he's talking and not pay attention to the mistakes or the stuttering they do. Now, when the child is excited to express his or herself, listen to them. Encourage other persons to do them.
Are super important. I'm really hoping that you noted every one of them, and don't rush these people. Don't make them feel uncomfortable in society. All of this is in line with the International Stuttering Awareness Day that just passed. It's a day to educate the public and show support to those who stutter, who feel alone due to it. Thank you again, Dr. Sintieh.
Thank you very much, Patience, for having me.
Congratulations.
Thank you.